provide any feedback if this was helpful, or information sessions like this that you would like going forward.
Give me
So
one
let us
second.
know.
Okay, this thing just came off on my computer. I'm not sure why.
I'm going to ask if you don't mind putting yourselves on mute, because I know we're going to have a big group today. And once Kevin tells me I can get started, we'll go ahead and get started.
Yeah. 3, 2, 1. Go ahead, Kerry. We got this.
Okay, awesome. Welcome everyone, all 123 of you on the Zoom call. Kevin and I were a little worried that our Zoom account wouldn't hold 100 and, well, now 125, but clearly there's no max, so this is really great news. We're really excited to host our very first interview preparation session with all of our newly graduated nurses and some of you who are still in your nursing programs who have joined us today. So welcome, and we're gonna go ahead and get started. My name is Kerry Zoss. I am a nursing professional development specialist here at Stanford. I am the coordinator of the nurse residency program. I work out of the Center for Education and Professional Development and have been at Stanford for my entire career. I started as a new grad in 2005, which for a lot of you is going to be like when you were really young. But I started in cardiac surgery. I worked there for about 8 years. During that time, went back to graduate school at UCSF, got my master's in administration, went into management for about 6 years, and really felt like my passion was mentorship, growth, and professional development of the future of nursing. So took a job with the Center for Education, worked on some educational rollouts, and then finally kind of landed where I feel like is my best fit, working with all of you. So really excited to be here today. I'm gonna go ahead and let Kevin introduce themselves. We're your dynamic duo for the nurse residency program. We work really well together and have a lot of fun. So Kevin, I'm gonna let you introduce yourself.
Sure, it'll be really quick. My name is Kevin Silvestre. I am in the nurse recruitment team here at Stanford. Been here for about 5 years now. Worked for a couple other health systems in Chicago and also in the East Bay prior to coming over here to Stanford. So we just wanted to give everyone a great, just this opportunity to, just a good preview of what our process is all about, what we look for, you know, in all clinicians here. So it's just going to be just a great session just to get to know us and our expectations and things like that. So if you have any questions throughout the process, feel free to DM me, add me on any of the social media channels, and I'd be glad to connect with you guys. So welcome.
So Kevin, when he built the registration process, allowed all of you to ask questions then so we could better prepare. So a lot of the questions that were asked have been built into this presentation. So I hope we answer most of those burning questions. If you feel like you have a question, put it in the chat. Kevin, I'm gonna ask to manage the chat, and then we, at the end, will have some time for some Q&A, okay? So as always, we have objectives. We want you to take something away from this presentation. So really the goal, just minimize that. Really the goal is that you have an understanding of the Stanford Health Care interview process for our nurse residents, that you'll be able to have an understanding of what behavioral style interviewing looks like and how you can best prepare to answer those style of questions, since those are the questions that we use to interview our nurse residents. We also want you to have an understanding of the program application qualifications. That question came up a lot when you were registering. What are the qualifications for the program? So we'll review that. And then the last 5 bullets really were the questions that came from all of you in regards to the nurse residency program and the timeline for our cohorts. What does clinical placement look like? How has COVID-19 impacted our program? Just a kind of a brief overview of our program, and then what are some of the challenges for some of our new grads. So we'll touch on some of that. So we're gonna dive right in, and we're gonna start talking about the interview process. The reason is, as some of you may know, we have our nurse residency program cohort 33. Initial interview panels will actually kick off on Monday for the cohort that will start in October. So for those of you who are participating in those sessions, I'm sure you're eager to get some of this information, so I thought we'd just hit the nail on the head and get started. So the nurse residency program offers essentially a two-part interview process. So there's an initial panel interview. Right now, our panel interview is virtual because of COVID-19 and our commitment to your safety and the safety of our staff. But normally, in other circumstances outside of COVID-19, it would be in person. Panel interviews are specialty specific. So what I mean by that is panel interview days are divided based on the specialty that you marked as your area of preference on your application. So if you said, I really want to work in critical care ICU, and you were selected for a panel interview, you will only interview for the critical care region. Same for oncology, medicine, and the surgical areas. Each of those special areas will conduct panel interviews over a 2-day period. They will interview 20 candidates per day for a total of 40 candidates per specialty. So over the 4 days next week, we will interview 160 potential nurse residents applying to our program. On the panel, if you are selected on the panel, you will be joined by 3 other nurse residents, making a total of 4 nurse residents on the panel. There will be a facilitator, and then there will be the managers representing all of the hiring units will be present on the panel. We always give the managers, and sometimes it's a management team, the opportunity to introduce themselves, and they will introduce the department in which they manage to all prospective candidates. Each panel will have a facilitator. I am the facilitator over medicine and surgery. My colleague Julian, who oversees the education for critical care, will manage the critical care interviews, and my colleague Yulia, who manages oncology education, will oversee the oncology interviews. Our role is to welcome you to the interview, to explain the process, so you're aware kind of before we start. We will ask all of the behavioral interview questions, and then we will close the interview at the end and provide next steps. All questions are behavioral style interview questions. I'll go over what that looks like in the next couple of slides. The interview itself lasts 1 hour, and all you are asked to do is answer 4 questions. So each candidate will be asked 4 questions. You will all be asked the same 4 questions, but the order in which we will ask and you will answer will rotate. So the structure of the interview, you will log into Zoom. I will welcome you, or your facilitator will welcome you. And the first thing they will ask you to do is introduce yourself to the panel. This is your time to kind of tell us who you are. We will ask you to share the following information with us: your name, your degree, the school where you graduated from, the nursing program, where you did your capstone senior preceptorship, what specialty area, any work experience, it could be healthcare related or it could be otherwise, and why you feel you'd be a good fit for Stanford. So this is an opportunity for you to tell us a little bit about you and why you feel you would be a good fit for this organization. We will then dive into the behavioral style interview questions. After all the questions have been asked and answered, the facilitator will conclude the interview and provide next steps. There's not an opportunity during the panel interview for candidates to ask questions. And the reason is because the panelists, all of the hiring managers, manage very different areas and are hiring into different shifts with different orientations. And so to kind of minimize confusion, we ask that you hold those questions for the opportunity to ask them at the unit level interview. At the conclusion of your panel interview, you will be instructed that your specific specialty panel interview will end on a specific day. So it will go something like this. Thank you for joining us for the medicine panel interviews. We started our panel interviews on Monday the 24th. They will conclude today on Tuesday the 25th. After today's interviews, the hiring managers will come together and evaluate all applicants. Should a hiring manager feel that you would be a good fit for their unit, they will reach out to you by phone in the next, and we'll give you kind of the day frame, but it's usually in the next day, and offer you a unit level interview. Unit level interviews will take place between, and we'll give you the days, but it's usually less than a week period. It's usually kind of, if you're interviewing your specialties on a Monday, Tuesday, unit level interviews would happen like Wednesday, Thursday, Friday, and the following Monday. So relatively very tight period. If you do not receive a phone call from a hiring manager, HR will reach out to you within the next 10 business days to let you know that. So that is essentially kind of how we wrap things up. Should you receive a phone call from a hiring manager who would wish to have a unit level interview with them, again, those will take place over the next few days. Human Resources and myself are emphasizing that those interviews should be a virtual platform, phone, Zoom, WebEx, something like that. Some managers feel very strongly that they want to meet the candidate in person. And so if that is the case, they have to ensure that they maintain social distancing, and all of our safe practices of hand hygiene and mask wearing is implemented during those interviews. Who will be part of that unit level interview? It's going to depend on the unit structure that you are interviewing for. You will definitely have a member of the leadership team, the patient care manager, and most likely the assistant patient care managers. The clinical nurse specialist may be involved, the unit educator may be involved, and they may ask staff to join as well. It is usually a hybrid of behavioral style interview questions and then individual interview questions. So this is the opportunity where they'll ask, what are your short-term goals? What are your long-term goals? What are you passionate about? What is your favorite thing about nursing? Tell us something about yourself that we don't know. So this is your opportunity to kind of show that personality and let them know a little bit about you. And then also the opportunity for you to ask all those questions. So what shift are you hiring into? Tell me more about the patient population. Tell me about the team dynamic and culture. What are the challenges of the unit? What are my opportunities to grow within your unit? How are you going to support me during my orientation? All those burning questions that I know all of you have, that is your opportunity to ask them. We get a lot of questions about, are you able to interview on more than one unit? So the answer is no. We ask managers to kind of duke it out over candidates after you all interview, and then the candidate is offered to come back to just one unit interview. So behavioral style interviewing is the interview style we use for actually all applicants at Stanford Health Care, not just our nurse residents. So for some of you, this may not be new information, but for others, it may be. So what is behavioral interviewing? It essentially focuses on a candidate's past experiences by asking candidates to provide specific examples of how you have demonstrated certain behaviors, knowledge, skills, and abilities. Answers to behavioral interview questions should provide concrete evidence as to how a candidate has dealt with the issue in the past. This information serves as the best predictor of how you will perform given a similar circumstance in the future. The questions tend to be very, very specific, usually asking you about a specific situation. What action did you take to respond to that situation? And then what was the outcome? We use behavioral interviewing because it's a type of structured interview style, and it allows us to objectively match the candidate to and compare candidates for positions by asking specific set of job-related questions. Essentially, it removes some of that subjectivity and bias out of the interview process. We'll talk about examples of questions, but oftentimes the questions are going to be phrased, tell me about a time during your clinical rotation where you demonstrated, observed, acted. Provide me with an example from your clinical rotation when you communicated, escalated, whatever that kind of role is. So you'll hear questions that sound very familiar to that. So how do you prepare before the interview? So what I want you to do is I want you to think about stories that illustrate times when you had successfully solved a problem or performed memorably during your clinical rotation or preceptorship. Oftentimes, newly graduated nurses look back at their opportunities to work as nursing students, and I went to USF, for all of you USF graduates out there, and I know how limiting sometimes and restrictive your opportunities are as a student nurse. We all know that. So all of your experiences are your experiences. They're your stories. We're not judging your story. We want to see how you're going to tell us that story, how you responded to that story, and what did you learn from that. So don't look for the most, amazing, I coded a patient by myself in the elevator. We know that probably didn't happen. But the small things that you did every day, the compassion that you showed to a patient who had no family members, the patient who was in pain and not responding to pharmacological pain interventions, and you brought ice packs and blankets and repositioning and music, and you did that. That shows compassion. That shows how you responded to a situation. That showed innovation. So be kind to yourself when you think of these stories, because they're meaningful and they're impactful, even if you feel that maybe your clinicals were a little limiting in your scope. So when you're thinking of these stories, think about the environment. What was your patient population? What was your setting? What was the issue you encountered? What was the challenge? What was the event? What was the concern? What did you do to manage that? Did you prioritize? Did you escalate? Did you utilize additional resources? Did you delegate? Did you communicate? How did you communicate? And then always tell us the outcome. What was the outcome for you? Was it an outcome for the team, for the patient? And then did you learn anything from that? Be open, be honest, tell us your story. We ask that you practice your questions. And the reason is, same reason I practice this presentation, is because the more time you practice speaking, the more comfortable you become, and then your confidence increases. It also gives you the opportunity to start fine-tuning those answers. We want you to share your answer in as clear and concise as you can. Now, we used to time people. We don't time people. I don't time people because that's just another layer of anxiety, and we don't want you to have that. But we want you to kind of be mindful of the time. Try to stay within a 2-minute window. If you go over, you are not docked any points. Don't worry about that. But just try to formulate your answers so they're clear, they're concise, and they're in a sequential order. This was my situation, this is the action I took, and this was the outcome. So when you think of, well, what is Kerry going to ask me during the behavioral interview question? Think about the role that you are applying for. So you're applying for the role of a clinical nurse. Think about all the things a clinical nurse is responsible for. Communication, time management, delegation, conflict resolution, compassion, caring, advocacy, how I prioritize my care, how I educate my patients, how do I escalate concerns, patient needs. There's a whole plethora. There's more than just this, but this just gives you an idea of all of the different roles that a clinical nurse is responsible for, and then different scenarios that we may ask. So tell me a time when you had to escalate care. What was the situation? How did you respond? What was the outcome? Tell me a time that you had to delegate to a colleague. Tell me a time when you observed conflict. What did you do? What was the outcome? So kind of start thinking about these ideas and then thinking about your own clinical experiences and fine-tuning those stories. So during the interview, so how do I best answer the question? I prepared, I practiced, I feel really good, and now I'm coming to the interview, and now I'm here, and now I'm super nervous because we're all super nervous during interviews. So how do I show my best self, right? The first thing I want you to do is always listen to the question. If you don't understand the question, or maybe your mind was racing and all of a sudden you're drawing a blank and can't remember what the person asked you, just ask them to repeat it. Oftentimes we have candidates who don't fully understand the question and therefore they're not able to fully answer the question. Usually the questions have multiple components. So again, tell me the situation, the action, or the outcome. That's usually kind of the theme. It may not be in those words, but that's kind of the theme of the questions. If you struggle with that a little bit, When you practice, try using the STAR method to structure your responses. I need to describe my situation or event that I was in. I need to explain what I was supposed to do. I need to describe what action I took, and I need to provide the outcome. And if you keep practicing that, you'll notice that it's like this beautiful sequence of events that just flows. The other thing is you want to know your audience. So if you are interviewing for the adult, so Stanford Nurse Residency Program adult, it would be helpful and beneficial to those who are evaluating you if they can see you and connect with you in the same environment that they are thinking of hiring you into. Now, that does not by any means mean you can't talk about maternity or peds or psych or community rotations. Absolutely not. It means don't just focus on one. So if I'm applying to the surgical adult panel interview or position at Stanford, and all of my answers are about my labor and delivery rotation, the hiring managers have a hard time seeing you transition into the patient environment that they're going to hire you into. So I recommend you can either showcase all of those rotations, or if you have really great examples from your adult rotations, I did CU, I did adult med surg, I did adult outpatient, bring those in because those managers are going to be able to make that connection. You will be asked questions that say, tell me about a time during your clinical rotation. So if the question is asking you about a time during your clinical, make sure your answer reflects a time during your clinical. We want to know how you performed when you were a student nurse, because as a student nurse, you are in the role of a clinical nurse. That is the role that we're hiring you into. So we want to know how you showcased yourself and performed in that role. Oftentimes, a lot of you have jobs in which you are nursing assistants, or perhaps you work in a surgery center, or you're a medical assistant, or another healthcare related field, and that's amazing and great. But when you provide your responses, try not to tell of stories when you were in the role of an NA or a respiratory therapist or a pharmacy tech, and shift it into, let me tell you how I performed in the role of a nurse, because that is the role that I'm interviewing for. And then lastly, allow your answers to be a vehicle to showcase who you are. So how did you connect with the patient? How did you contribute to the team? How did you rise above the challenge? So kind of allow us to get to know you a little bit in those answers. So just a couple of behavioral style interview questions that I came up with. These aren't any of the ones that we use, but it just kind of gives you an idea of a potential question. So tell us about a time during your clinical rotation where you needed to escalate care quickly and efficiently. What was the situation? What action did you take to escalate this care, and what was the outcome? So again, 3-part question, kind of in that sequential order. Second one is very similar. It's about delegation. Third one, tell us about a time when your patient's plan of care suddenly changed. What was the situation? How did you respond to the change? What was the outcome? So I had a plan of care for my patient, then all of a sudden it was disrupted. What caused the disruption? How did I respond to the disruption? And this was the outcome. So just kind of an idea on some behavioral interview style questions. Okay, so I'm going to shift gears and we can take questions at the end. That kind of focuses most on the interview process. We had a lot of questions about program qualifications. So I put these up here. These are also on online when we open our program. These qualifications will also be there. So pretty simple qualifications. Have to have a BSN or an MSN from an accredited Commission for Education and Nursing or Commission on Collegiate Nursing Education program with an official graduation transcript no later than 18 months from cohort start date. And we will put what that time frame is in these qualifications. So if the program starts in April, we go back 18 months and you would have to have graduated within that 18-month period. You must have a current California RN license that's visible on the website by the Friday prior to the start of that initial panel interview. So you can apply to the program, we can screen your application, and we can offer you an interview. But if you don't have your California RN license, Kevin will be touching base with you by the Friday before that panel interview to see if you got your RN license. If you did, great, you can sit for the interview. If you didn't, we're not going to allow you to sit for the interview. Same with your BLS and ACLS, the Friday prior to your interview, that initial panel interview. We're going to ask you to submit all of the required documentation for the program. So one is that you complete the electronic application. Two is we ask for 2 letters of references from nursing clinical faculty. Let me say that again. 2 letters of recommendation from your clinical instructor, but your clinical instructor is faculty at your School of Nursing. So this is not your preceptor. So this is the clinical instructor who works for your School of Nursing who oversaw your clinical rotation. They may also be faculty who taught the theory course, and that's fine. We're just going to ask that they speak in some facet to your clinical performance. They can talk about your theory and how you worked within the classroom, that's completely fine. But we want to see that they shine a light on your clinical performance in the clinical setting. We ask that your resume, all of your resumes are always so wonderful and great. We don't have a lot of requirements for the resume. The one thing we ask is you list your clinical hours and locations for all of your rotations, including your capstone and preceptorship. If you are applying for the program and you are still in school, that's okay. You can just kind of give a timeline, you know, May until or in progress. That's totally fine. We just like to see where you've been and what experiences you've had. We ask for your transcripts, and then you can work as a registered nurse and still apply for the program, but no more than 6 months experience as a registered nurse. And then we ask for you to commit to our 1-year residency program with no foreseeable break in service. So this is our qualifications. They will be online when the application opens. So you can read through these, and as long as you have all of this, Kevin takes your application and he sends it to my team. If something is missing, Kevin and I usually have a conversation, or he'll send it to me and I'll say, I don't see the letters of recommendation for this person, and we'll work and see if it was an upload issue. But as long as you hit the mark on all of these, your application gets routed from HR to my team. So our program, we have 3 cohorts a year. We have a fall, a spring, and a summer cohort. Our fall cohort will start the week of October 11th. Our spring cohort will be in February. I don't have the exact dates. We should be nailing those down in the next 2 weeks. And once we have those dates, Kevin and I then make the whole timeline of exactly when the application will open, when it will close, when interviews will be, and when offers need to be made. And I will ask Kevin to promote that information on social media so you can all have that. And then we will have a cohort in the June timeframe. Again, we should nail down those dates in the next 2 weeks, and we can provide them to you. Currently, we are hiring into 4 regions. Our critical care units, so those are our 5 ICUs, which is neuro ICU, trauma, cardiac surgery, cardiac medicine, so cardiology, and then medicine oncology. We're hiring into oncology, so BMT, blood and marrow transplant, hematology, and oncology. Surgery, so you'll see here it says surgery AAU. AAU stands for Acuity Adaptable Unit. So besides critical care, float pool, and observation, the rest of the units at Stanford are acuity adaptable, meaning they are a mix between intermediate, ICU, and med-surg. So a couple years ago, we got rid of the intermediate units and the med-surg units, and we basically combined. So we're not transferring patients from an intermediate ICU to a med-surg unit because their level of care changed. Rather, we're flexing on our unit to take care of that patient population and meeting their needs in one location. So less movement of patients, and you get to really hone in on your specific specialty. So for surgery, neurosurgery, orthopedics, thoracic vascular, cardiac surgery, liver kidney transplant, ear, nose, and throat plastics, plastic surgery, pain, and then gynecology is another unit, urology, colorectal surgery, abdominal surgery, hepatobiliary, and then minimally invasive surgery. These are our main service lines. And then medicine, general medicine, we actually have a COVID-19 unit. It was a general medicine unit. It has transitioned temporarily into a purely COVID-19 unit. They are hiring new grads. Chronic lung disease, cardiology, neurology, and then orthopedic medicine. We also have a float pool. The float pool goes to all of the AAU units, including oncology. They are hiring new grads. They have an extended orientation just because there's a little bit more of a skill set and education for our float pool new grads, but they do really, really well, and it's a great team. And then observation. So we do have an observation unit. It's a 36-bed unit. They take new grads. Often there's a lot of confusion about what does observation mean. For all intents and purposes, it functions as an inpatient unit. They see both medicine and surgical patients, but their patient population normally doesn't stay for longer than 72 hours. So they're considered outpatient, and they bill that patient for outpatient. But for all intents and purposes, if you were to start, it functions as like an inpatient unit. You work 12-hour shifts, 3 days a week. It runs 24 hours a day. It's a combination between medicine and surgery. Okay, so one of the big questions that we had was, how did COVID-19 impact our residency program? So we were committed to kind of keeping our program goals despite kind of the environment in which we are in. So we are committed to still offering the 3 nurse residency cohorts per year, and really committed to increasing the number of nurse residents per cohort. And I'll show you in a slide or two how we're doing that. And then we made a commitment to expand our program to include the ICUs. That actually just started this summer, and we're going to keep on that going forward. Some changes we have made because of COVID. So I conduct nurse residency seminars with all the nurse residents monthly. Those have now all gone virtual. So it was live, and now we're using a virtual platform to get that impactful work done. Our interview process has now gone virtual. For our curriculum, we've really increased an emphasis on stress management, nurse resiliency, and self-care. We've provided a lot of content and education on how do we care for patients during this time, and not just COVID patients, but patients who are in the hospital during a pandemic with the limited resources they have, and the no visitors, and the fear, and the stress, and the worry. It's kind of a layer that we hadn't seen before. So we talk a lot about that. And then how do we care for ourselves, and how do we care for our teams? We realize that for some of our newly graduated nurses, their program may have abruptly ended right before graduation. It was modified, it went virtual. So there may be a little bit of an education gap. So when you start the program, we use software called Virtual Jane. It's an interactive software where you essentially talk to the computer, you type, it's like you text. And it's a series of vignettes of stories of a patient who's not doing well, and it's asking you kind of how you would manage this situation, how you'd prioritize, how you would monitor, what interventions would you do, and then would you escalate this patient. And we take all of that data after you complete that assessment, and we look to see where the gaps are. So if we're looking at our cohort and we're like, clearly there's an issue with stroke and the management of stroke, we really need to put a hyper emphasis on that. Or maybe there's a solid connection that we're not escalating care and that's being missed, we fill in the gap. So the goal of the nurse residency program is not to teach you what you've already learned in your undergrad or graduate program. You essentially are coming to us with more knowledge than we have. So you teach us a lot of things. I've been out of school for quite a bit of time. So the goal is not to reteach you what you've learned. The goal is to say, you have this really strong foundational knowledge. I gave you a knowledge assessment test. I see that there's a gap. I'm going to fill in that gap. And then I'm going to work with you to take everything that you learned in your nursing program and teach you how to apply it to the patient at Stanford. So how do you manage the stroke patient? How do you manage the respiratory patient? How do you manage the delirious patient? Whatever that looks like, rather than what is delirium? What is a stroke? Because we know you already have that. We also used to partner with a local university and use their simulation lab, but due to COVID, that simulation lab has temporarily closed. So we kind of pivoted and created our own simulation lab, and now we run small group simulation with our nurse residents. So we give them that foundational clinical knowledge at the beginning, management of the septic patient, management of the cardiac patient, management of the neuro patient, management of the pulmonary patient. Then you come to simulation and you're gonna run through a case. Very different than sim and nursing school, more interactive, more fun. You get to work with partners. You try to kind of work through this case, what might be going on, and an opportunity really for you to engage and learn. And then with that, we offer kind of a skills lab. We bring all the skills to you, give you the opportunity to kind of independently move around and be like, I'm really not strong with the crash cart. I'm really not strong with the defibrillator. I'm really good on IVs. I can skip that. I'm not great on chest compressions. I want to practice that. And so just an opportunity for you to touch and feel kind of that high volume, maybe, or low volume, high risk situations. And then most recently have worked with Kevin and HR to really reach out to our newly graduated nurses and give them the information about our program, so how we can support them and become part of our Stanford family. One of the questions we saw a lot is for those of you who, again, had some sort of modification to your program, to your senior clinical rotation, if those changed, if those were canceled, if those were modified, or if those went virtual, any of those modifications do not negatively impact your application. So we understand that some of you were not able to fully fulfill the hours that you thought you were going to. That's okay. It doesn't impact your ability to get an interview or your ability to get hired. So a couple questions were asked about volume and then retention. So you can see, and this is fiscal year. So fiscal year September through August. So fiscal year 16-17, our volume was in the 60s, and then it dropped dramatically in fiscal year 2018, fiscal year 2019. Again, there was a lot of gearing up for the opening of a new hospital, so we kind of gauged back a little bit. And then fiscal year 2020, we were like, let's just do it, and had some of the biggest cohorts we've ever had, and continue to expand and grow as we go forward. The organization's goal is between 10 to 15% of our nursing workforce should be new graduate nurses, and that's anywhere between 54 to 87 new grads per cohort. So right now we are in the 50 range with the goal to keep moving that number up. Our retention rate is actually pretty high. It's above the national average. So for fiscal year 20, actually, all of these new grads are still in their program. None of them have left. 100% retention rate at this point. The 26 in fiscal year 2019, this was two different cohorts, 100% retention rate. Fiscal year 2018, we're about a 90% retention rate. 2017 is 83, which is actually quite high. And then we drop fiscal year 2016. We get a lot of questions about why they might be. To be honest, we probably don't do the best job tracking that, but what we do know is it's very expensive to live in this area. The majority of our new grads are right out of school, younger in age, just starting their career. And so we're kind of reaching that 4-year mark and life events start happening. So they're interested in buying a home, they're interested in having a partnership or getting married or starting a family, maybe going back to school. And so they're moving based on a lot of life events is what we see. Okay, what do you look for in an applicant? So this is a big question that we got. So the initial application screening is done by myself and my team. We look for a complete and thorough application. So that's the first thing. And then we look for that well-rounded individual. Any type of work experience, please share that with us. Did you do an internship? Are you a volunteer? Tell us that. ACLS, We give credit for ACLS. All of our units are cardiac monitoring units, so we do give credit for ACLS. If you don't have ACLS, does that mean that you're disqualified? No, but we just give points if you have ACLS. Any extracurricular education, so maybe you went and got NIHSS certified, maybe you took the EKG and pharmacology education credits, anything extracurricular, add that to your resume. Where the most of the weight of your application goes is to the answers to the questions that are in the electronic application. Because this is an opportunity for you to tell us about you and showcase your experience. Again, we realize you're at the advanced beginner level, right? We're following Benner's model. So you finish school, so you're no longer a novice, but you come to us at that advanced beginner stage. And then our goal is to get you to that competent level by 1 year. So we're not judging your experience. We're looking at how you responded to that experience and how you answered the question. So again, tell us about your compassion, your ability to critically think, your ability to accept and apply feedback. How did you prioritize? And that you answered all the components to the question. A lot of times we see answers, and I'm just going to give you an example. So our last application had, tell us about a time during your clinical rotation where you received constructive feedback regarding your performance. Tell us a situation, action, and outcome. A lot of it is about time management because we know that's something you're working on and it's great. So an answer that we struggle with a little bit is during my clinical rotation, my preceptor gave me feedback on time management. Perfect, that's the situation. I went home and improved my time management. And then by the end of my clinical rotation, I was able to delegate and cluster my care and clock out of work on time. So I heard the situation and I got the outcome. But the action was very vague. What does it mean to work on my time management? Tell me what that means. So does that mean you created a new brain sheet? Does that mean you asked your peers what they do? Does that mean that you embrace the concept of clustering care? Does that mean that you learn to delegate more? Just tell us what that means. So to kind of try to eliminate the vagueness out of it so we really understand what you did. And then we look at your letters of recommendation that are 100% always very, very positive. And we looked at that clinical faculty member really highlighted your strengths in regards to your clinical rotation. Then you come for the interview. So what do we look for in the interview? So I am not a hiring manager, but I used to be a hiring manager and I sit through all of these interviews. And I can tell you the question that is asked all the time, and it's in bold. The manager will say, will that person be a good fit for my team? Do I see them molding into my current team? Do I see that they would work well with the staff I have, that they would make friends, that they would have a friendship, that they would have a buddy? So much of nursing is that team dynamic, and the ability for you to be successful is the ability for you to be able to work within that team. So that is the question that they're always asking. So we want you to demonstrate and kind of give insight a little bit in your questions, how you've been a team player. Are you flexible and adaptable to change? Are you compassionate? Can you embrace feedback? Mold that into your questions and have fun. Smile. Tell us your stories. Let us see your personality shine. So much about nursing is that human connection. It's a little difficult over Zoom, but I do have to say that our previous interviews that we did a couple months ago, they actually went really well and we were able to see that. So allow that to shine even amongst all the nerves. Show us who you are. Okay, this is a very busy slide. I'm not going to go through all of it. There's a question about the program, the nurse residency program. So it is a 1-year program. It consists of your clinical orientation, your nurse residency program seminars, simulation. You do an evidence-based project. And then there's a lot of formal, informal check-ins and roundings so we can really elicit that support. So if you are hired into the AAU environment, that's medicine and surgery, you get 288 of direct clinical orientation with a dedicated preceptor. So it's approximately 24 shifts, about 2 months. If you're hired into the ICU, you have an extended orientation. It's about 420 hours, so 35 shifts. So the goal of your orientation is we want to watch this progressive. So Not right away it's going to happen, but this progressive transition into independent practice, we want to see you start developing a skill set, developing that clinical reasoning, that critical thinking, your ability to communicate, and your awareness of what are the policies and practices of my unit and of Stanford. A lot of times nurse residents focus on the tactile skills, the IVs, the NG tubes, the Foleys. While that's all super important, there's also another layer of skills that we really try to get you to hone, and it's the critical thinking and the documentation and the communication and the ability to delegate and the ability to escalate. So it's not just the tactile skills, but really kind of encompassing everything that you really need to function as a competent nurse. Then I meet with you every month, and it's a mix between like lecture, team building, group work, case studies. We do something called reflex sessions where we talk about what our experience have been at the bedside during our time at Stanford. What have we learned? The research has showed that the highest level of adult learning is when we reflect on our experiences, we learn from them, and then we share them. So we give you the opportunity to do that. Our topics are really, we have a pretty robust curriculum, and again, it changes, so we kind of keep up with what's most relevant, but we look at what are your learning styles, how do you learn best, so you can go into that orientation and really learn from your preceptor. We talk about the cardiac, pulmonary, neuro-oncology, and septic patient. We do a whole communication workshop. We look at ethical considerations. Again, a lot on nurse resiliency, stress management, self-care. We do a whole professional growth and development workshop. We realize that the generation is changing, and the likelihood that we are hiring clinical nurses to be at the bedside for the entirety of their career is very, very small, and there's nothing wrong with that. We need those people, but we know that the generation is changing and people are looking for change and growth and challenges, and so we need to support that within Stanford. So giving you an idea of all of those opportunities. A lot of work on workplace violence, implicit bias, diversity, inclusion, social determinants of health. A lot of guest speakers come. It's not just lecture. A lot of case studies, a lot of team building. We do gamification, discussion. So we're trying to make it really, really interactive. Again, we do simulation and skills, talked a little bit about that. That's an opportunity for you to demonstrate your understanding of what you're learning. You do an evidence-based literature appraisal. We start that work about 6 months. You work in a group, and then you present your findings at your graduation. And then a lot of check-ins from my team, from your management team, from your clinical nurse specialists, just to make sure you feel really, really supported within that first year. This is some of the work that we did before we went all virtual. This was one of our last seminars. This cohort started in November, right before the new hospital opened. This is cohort 30. So we have a lot of fun. The goal is to make this fun. Okay, so what makes a nurse resident successful? I want to say it's patience. So the transition to independent practice and really feeling comfortable is a process, and you can't rush it. If you willingly and openly embrace feedback and apply that feedback into your practice, you will be successful. I always say, if you don't know something, you ask before you act. That is just kind of the gold standard for safety. Accept that learning is going to take time, and in healthcare, because change is really the only constant, dedicating yourself to be that lifelong learner. Really caring for yourselves outside of work, building relationships with your team, celebrating your successes and the wins, but also acknowledging that this job can sometimes be really hard and it can be really sad, and allowing yourself to feel that and getting support. When I started, we didn't talk a lot about that 15 years ago, and so you would have an event and maybe your patient didn't do well, and it was a really sad case, and then you just kind of went home and dealt with it on your own. And so the nurses that I started with 15 years ago, 85% of them are no longer in this profession for reasons like that. So healthcare has changed a bit because we realize that burnout is real, and we don't want that. So it's giving you the opportunity to really feel that and giving you the resources to support you through. always asking for help all day, every day. You got to ask for help, that you learn from each other. And then once you've learned from someone, that you're willing to teach somebody else. And then, of course, you've got to have fun, because work is work. And if work isn't fun, well, then work is just work. So I started here as a new grad. It's been a joy working at Stanford. I love it. I have fun every single day. I'm challenged every single day. So I think if you have an element of fun and friendship and laughter in the work you do, it makes the job super worthwhile. Okay. Kevin.
Yes. There are a couple questions. Ready?
Yes.
Okay. The first things, you know, there are the specific questions that we ask on the actual application. So one question was, so we should, when we're actually selected for an interview, should we use different clinical examples than the ones that we wrote about on the application?
No, you don't have to. And in fact, the managers who are sitting on the panel, they didn't read that application and screen it. My team did. They have access to that. But if that is a moment where you feel like that is memorable and I really had the ability to shine, then tell us about that.
And then another question was about ACLS, and I can answer this too. It says, oh, hold on. Whoops, it's going away. I would like to clarify the ACLS requirement. On one side, it said that it was needed by Friday before the panel interviews, and they described it as just a bonus to have the ACLS before the beginning of the program. Do I need to get the ACLS prior to my interview? So I answered it already.
Okay.
I said no. I mean, it is a plus that you have it, but in all honesty, we give our new grads at least 6 months upon hire or after hire to obtain the ACLS if you don't have it at the time of the application. Let's see here. It says here, I know you mentioned it's better to use experiences from being a student nurse, but can we also use experience from being an LVN in terms of answering the questions?
So my recommendation, if the question says, tell me a time during your clinical rotation, then I would use a time during your clinical rotation. If the question does not use clinical rotation, then you have the opportunity to share any experience, work-related or otherwise. Oh, you're on mute.
Can you hear me now?
Yes.
Okay. It says the next question, are we able to submit a portfolio before our interview? Thank you. Mike, my answer is no. We already have all the documents in the system, and all of our hiring managers will have access to that information, whatever you submitted at the time of the application deadline. Another question, it says here, who are the mentors and preceptors of this program?
So the preceptors are unit-based. So we'll just use an example. If you are hired into the cardiac ICU, your preceptor will be a cardiac ICU nurse who works on that unit, who has gone through preceptor training. You are usually assigned a primary preceptor, and then you are assigned a backup secondary preceptor in the event your primary preceptor is sick or needs to be the charge nurse because there was a scheduling issue or something like that. So your preceptors are your colleagues who work on your unit who are now taking on the role of precepting you, and they have gone through specific training. We have a formal mentorship program at Stanford. We give you kind of the opportunity to go through that formal mentorship. At about a year's time, I invite the leaders of that mentorship program to come and teach you about the program. You have a lot of informal mentors during your orientation. So I essentially oversee all of you because I love all of the new grads, so I cannot choose, so I take all of you. But on my team, I have someone over the medicine and then surgery, oncology, and critical care. So it's about like a 1:10 to 1:15 ratio for them. So it's a little bit more intimate, and they provide that direct kind of mentorship over you, help connect you with your management team. I will say there are probably more people invested in you than you're like, there's too many people in the room. So we kind of all come at once, and then as we watch you grow, you form those connections with certain people, and then we kind of allow that mentorship with that person to kind of carry you through.
Another question, what does extracurricular education include? Are these classes to take at school, or where would I take them?
So you can take, not at school, so you can take them through, for example, American Association of Critical Care Nurses offers classes. The California Nursing Association offers classes, and a lot of them are kind of the same. It's a type of certification. I'm EKG certified. I've taken so many hours of continuing education. NIHSS is your kind of stroke scale certification. Again, not required. It just kind of shows another level of investment on your side if that's something you're really passionate about.
I currently work as a clinic RN and feel like I have very relevant experience there. If I share only examples from my current position, is that not recommended during the interview process?
So my recommendation is, if the question says, tell me about a time from your clinical rotation, I highly recommend that you share a time from your clinical rotation. I would hate for you to tell a story and the hiring manager said, this person didn't answer the question. They told me about a time from their job. So if the question asks about a time during your clinical rotation, I would veer down that avenue. And there are questions that don't say that. They all just say, tell me a time. And so those opportunities are for you to speak of those other experiences.
It says here, do the hiring managers review our resume and application ahead of the interview?
Usually, to be honest with you, so it's a yes and no. So they're going to sit through 40 panelists. So what they usually do is, in person, they have it right there in front of them. And then on Zoom, I give them access. So as they going through, they're kind of looking at the resume to the person, looking at the resume to the person. And then if they feel there's a good fit, they look at the resume in more depth. They all have access. Some are very, very vigilant and already have it all out and print it and highlight it. Others kind of have been doing this for a long time and multitask. But they look at it in some facet.
Is it too late to apply for the upcoming October cohort? Yes, but we are still planning on the first few cohorts of 2021, and I'll definitely share that information on our social media channels. Next question. When telling the panel about our work experience, should we just stick to one position, or can we briefly discuss multiple positions?
I think highlight yourself. So if you worked at Starbucks for the last 3 years, and before that you worked at In-N-Out Burger for 2 years, tell us about that. Customer service is huge. We want to know that. I would not go back so far that you're going to lose your audience, but I would say in the last few years, and some of you are coming as second careers, tell us about that. All of those experiences build on who you are, so we want to know that. Would I say like I was a babysitter in high school? Probably not, but maybe start like when I was in college and then after.
If we have work RN experience, can we use those experience to answer the behavioral questions during the interview process?
So again, if it's clinical, if it asks for your clinical rotation, answer for clinical rotation. If it doesn't say clinical rotation, then you can absolutely use your work RN experience.
Is a 2 or 3 page resume too long? Should we stick to 1 page? I've heard many different answers, and I have 2. So my opinion, and I'll have Kerry respond as well, as long as you have a detailed resume that actually outlines all of your, just the main meat of what we're looking for, your experience, degrees, certifications, etc. I'm cool with that. Kerry, what do you think?
Yeah, we don't penalize if you go over 1 page. So I know with your clinical rotations that we ask you to put, it takes up a good section of your resume. So many go over 1 page. So we don't penalize if you go over kind of the 1 page limit that a lot of resume prep people will tell you to keep it to 1. So again, tell us who you are. We read it all, and we don't penalize based on number of pages.
Do candidates need to meet a GPA threshold for screening? And it says here, are candidates viewed holistically, school, difficulty, etc.?
So the GPA comes into account when Kevin calls me at the 11th hour and says, I need 2 alternate candidates. I have 2 spots left for the ICU panel because the ones that I sent him, 10 of them have already taken jobs. So we need some additional candidates. So I say, okay, Kevin, our cutoff score was 32. I need to look at the 32s. Who wanted ICU? And now I'm going to filter and go by GPA. And so that is the one deciding factor where GPA comes into account. Do we look at school? Do we rate schools and give credit? No, we don't. We also don't give credit based on BSN or MSN. We kind of take you as you are a newly graduate RN. All of your schools are accredited through these 2 accrediting bodies, which we feel hold you to a specific standard. You meet the criteria for the number of clinical rotations and hours that you need to have to be accredited. And with that, we kind of look at the candidate rather than the school.
Is there any way to submit a thank you note after the panel interview? Thank you.
So you guys are always like the most wonderful, timely, like sincere, gracious people. You do not need to. And the reason is because again, there's a lot of you and there's not a lot of us. And so we ask that, we know that you're grateful and we appreciate that. I let the managers know that I and Kevin kind of say, you don't need to submit a portfolio and you don't need to submit a thank you note. So the managers are not expecting that. So we just tell you that's not necessary.
For clinical rotation specific questions, would experiences from a senior preceptorship, would experiences from a senior preceptorship work as well, or does that count as work experience?
No, your senior preceptorship is part of your clinical rotation. So, and any type of where you functioned as a student nurse. So if that was an internship, if that was a clinical preceptorship, or if that was just kind of like your junior year, sophomore year clinical rotation, all of them count.
And then Kerry, I could answer this one. It says, how many applicants do you usually get with each application period? I'll just give you an example for this one. We received 678, and out of that, we narrowed it down to the top 160 who will be interviewing next week. It says here, are there additional requirements for those applying from out of state?
No, you just, so just a little for our out of state folks, the California BRN is not the quickest group to get licenses processed. So just be mindful of that. For those of you who have out of state licenses and you're trying to transfer to the California license, just be mindful of that.
Okay, I'll answer this question too. How many candidates are interviewing for each area? Example, oncology, versus how many spots are they hiring for? For each section or for each division, we're interviewing a group of 40 total. But the actual final spots, like Kerry said, it's looking around 50 right now, but we don't have the final official number yet, but we should have it probably within the next week and a half or so. Let's see here. For our introduction to the panel, or introduction in the panel interview, do you recommend sticking to the 2-minute time frame as well?
Yes.
Can you briefly go into the timeline of when we should start to apply? For example, if we're just graduating in the spring, do we expect to apply to the June cohort or the fall cohort, etc.?
So you can, well, Kevin, you can provide some guidance, but you can, so if you're gonna graduate in May, you can apply to the June cohort, even if you haven't graduated.
Right.
Your graduation transcripts will be, or your transcripts will be in process. And if there's any need, Kevin can always reach out and say, can I get your final transcripts? But you can still apply to the program even if you haven't graduated, but you will be graduating before the panel interview starts.
How should we present our clinical hours? Do we need to do a breakdown for each rotation and site, or do you just need total number of hours completed?
Do a breakdown. So if you, and how you do this is totally up to you. You can do it in table, you can just list them, but you would say something like, you know, med surge rotation, medical surgical rotation, Stanford Hospital, telemetry, 180 hours. Psychiatric rotation, outpatient, psych services, St. Francis Hospital, 200 hours.
My university does not have a senior capstone, but I do have a course called Transitions to Practice, where they explain that it replaces an actual senior capstone. Is that still okay to explain during an interview? I would say yes.
Yes, yes.
A question probably everyone's wondering, I could take this one. Have all the candidates for interviews been contacted? No, I'm still doing it. So as soon as we're off this call, I'll have to contact another group of individuals. And then for those who are not selected, I'll definitely send a personal email to everyone as well. Oh, this is a good one. Ready? What are interviewers' biggest mistakes? Also, how soon can a new grad participate with Stanford's PNDP or Professional Nursing Development Program courses?
Okay. So couple biggest mistakes, and then Kevin, we might have to wrap up because I know we're over our time. So I would say things that I would recommend not saying during an interview. I would recommend steering away from words like, I was taking care of a frequent flyer. I was taking care of a very difficult patient. Labeling, I think that is something. Another pitfall is because you hear other people's answers, you get swayed a little bit and you then think that's the answer and the direction I should go in. And so you kind of drop what you probably intended on saying, and now you're going to follow that candidate, and really that candidate didn't hear the question. And so now everybody's answering the question wrong. So listen to the question with your own ears, because someone may hear it differently and then answer it differently. I think when you're talking about taking care of a patient, saying things like, I was really scared, I was really nervous, I was really scared, makes a manager think, are they going to be really scared and nervous all the time? Or was this just kind of that one? So you always want to phrase yourself in like a really good light. You could say it was a challenging situation, and I knew I had to delegate, and I knew I had to escalate. And even though I had never been in this situation, I went and did A, B, and C. So inside, we're all dying, of course, in these new situations, but how did I get through? The Professional Nurse Development Program, you can start applying after you have to have 2 years of experience at Stanford.
And Kerry, since we're running out of time, what I'll do is I'm copying and pasting every single question that's coming through, and then I will, I'll send them over to you, and then we can attack them together and send them out.
Okay. So for all of you on the call, if you would be so kind and to take out your device, and if you could scan, there's only 3 questions, I believe, 3 or 4 questions. Kevin and I just want your feedback. We are committed to offering more of these types of sessions. We'll most likely offer one before the application opens for the spring program to kind of talk about that program and any sort of information that you guys would like. So we just ask for your feedback so it steers us in the right direction and we can meet your needs. So if you wouldn't mind doing that. And then, just because this is my thing, I always tell my new grads I have to leave them with something to consider and ponder. So for all of you who are looking to start your careers, and it can be a little overwhelming, just try to honor the space between no longer and not yet, because that's where you are, maybe no longer a student and not yet a hired clinical nurse, but it will happen. So be patient. This has been a lot of fun. I hope you guys enjoyed it and got something out of it. And I thank you for joining Kevin and I today. Take care.
Thank you, guys.
Bye, you guys.
Thank you.